old is too old to be sucking your thumb? That is a tough question. Joining us now is cosmetic dentist, our friend, Dr. Bill Dorfman. Welcome back, Bill.
Hey, thank you, Dr. Drew. How are you?
I love that setting. Clearly, you must be in the mountains, right?
I am. I'm in Park City, Utah, actually Deer Valley, right here.
Nice.
Dr. Dorfman, so we have to talk to you about this because, even as a psychiatrist, this is fascinating, just the behavior itself. Jenna Bush Hager recently came out and admitted that she still sucks her thumb. What do you think? You think she's a bit too old?
Well, yeah. I mean, look, ideally, you want to get kids to stop sucking their thumb as early as possible, right? But at the latest by age 3. Why? Think about this. When you place your thumb in your mouth, you're putting pressure on your teeth. It's just like orthodontic movement. It's like wearing braces, except you're pushing your teeth out. And this causes skeletal deformities, can actually even lower your nose. So because some kids hook their finger on their nose while they suck. So it can really deform your appearance.
I find the fact that Jenna Bush came out openly and shared this information. I mean, have you seen adults come into your practice who still suck their thumbs?
Yeah. And, they're really ashamed of it too. But what happens is you get this condition called an open bite. And I think we have a few pictures that we can show you where basically your back molars are closed, but your front teeth still remain open. And it can be really, really dramatic in some people. It also can impede your speech. And between that and, the deformity, a lot of people really suffer. They're shamed, they're bullied, they have really low self-esteem. So the best way to remedy this as a parent is to start off with what we called yucky stuff. My twins were really good thumb suckers. And so you buy this stuff, you paint it on their nail. It's like nail polish and it's non-toxic. So you're not going to kill your kid. It's not going to hurt them, but it's really, really foul tasting. And if you start doing this like at 2 or 3, normally it'll abate immediately. But as an adult, and when everything else fails, you call your local orthodontist. And what the orthodontist will do is they'll put a little appliance in your mouth. It attaches to your molars. There's a strap that goes across your palate. It's called a crib. And it's got little spikes on there. So when you stick your thumb in your mouth, ouch, it hurts.
Whoa.
And that literally works every time because it's not removable.
Wow, that's like a little bear trap in your mouth. Dr. Sportelli, do you think there's more reasoning as to why adults suck their thumbs?
Oh, yeah. Oh, my goodness. Did we just open up a psychological can of worms here? Listen,
Freud would love this.
It's a behavior, right? It's a behavior. So there's a reason that they're doing it. And look, it could be anything from just a habit to a security to a compulsion. Listen, sometimes people actually regress into childhood after trauma. I mean, so it's something that should be sort of investigated a little bit deeper to make sure there's not something else going on. But I'll tell you what Dr. Dorfman is talking about is exactly what we would do. That's something called applied behavioral analysis, the ABCs of behavior. You have the antecedent, the behavior, and the consequence, right? So the antecedent is the trigger to suck your thumb because it's soothing. The behavior is sucking your thumb. The consequence is, oh, that made me feel better. So in Dr. Dorfman's case, what he's saying, if you put something uncomfortable in there or something that doesn't taste very good, you have the desire to suck your thumb, you go to suck your thumb, and then the consequence, the C, is, oh, that's terrible. So eventually you stop sucking your thumb. So it's a perfect example of what we call applied behavioral analysis. But in reality, I think it's probably just a habit, but should be looked into a little bit further if it continues.
Interesting stuff. All right. Thank you very much, Dr. Dorfman and Dom, as always. Interesting analysis.